Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the anatomy of the Norma Occipitalis, that is the posterior aspect of the skull. The Norma Occipitalis is convex from side to side and from above downward. So from side to side, above downward, it is convex. It is flattened below, bones taking part in the formation of Norma Occipitalis. Above the posterior part of the parietal bone, these are the parietal bone, this side, and the below upper part of the squamous part of the occipital bone on each side with the mastoid part of the temporal bone. Okay, suture with the lambdoid suture here, lambdoid suture, occipitomastoid suture, occipital bone and the mastoid bone suture, and parietomastoid suture is here, parietomastoid suture, and posterior part of the sagittal suture. Okay, so if you like make to big it, okay, let me do it here. So here is the posterior aspect of the skull, that is the Norma Occipitalis. Bones are the parietal bone here. Here has one parietal bone, another parietal bone. This is the superior, this is the sagittal suture, and these along with this we have the lambdoid suture. This is the lambda here. Okay, this is the lambda, and this is the external occipital protuberance here, and we have the superior nuchal line from there, superior nuchal line. We have the highest nuchal line, not very distinct here. Okay, so superior nuchal line, and above that we should have the highest nuchal line that may be absent in many of the skull specimens. Okay, we got that, and this is the mastoid process of the temporal bone here. This is the occipital bone. Occipital bone is here. Okay, and these are the parietal bone. This is another one is the parietal bone here. Okay, we got that. Now we'll go to the next slide here. Here is the sagittal suture. This is the lambdoid suture here. This is the lambda, and parietal bone, another parietal bone is the squamous part of the temporal bone. This is the external occipital protuberance, superior nuchal line here, another superior nuchal line. We might have highest nuchal line, not distinct here. Okay, we may have separate small piece of skull bone here. It is called extraparietal bone or Wormian bone here. Okay, this is because of multiple suture here. Sutures are the fibrous joint we discussed previously. And this is the mastoid process, and this is the occipitomastoid suture, and that is the parieto-mastoid suture. Okay, sutures are the sawtooth-like joint of the two bones. These are fibrous joints. Okay, again we got that the Norma Occipitalis. These are the bone. We have the major suture, sagittal suture, lambdoid suture. We have also, this is the occipitomastoid suture. This is the parieto-mastoid suture. Okay. Features of Norma Occipitalis: lambda, parietal foramina. Parietal foramina is present in the parietal bone. We have discussed in our Norma verticalis, nobilion, we discussed in our previous video, the point between two parietal foramina. Okay, external occipital protuberance, and the Inion, the most prominent point on the external occipital protuberance. Superior nuchal line, carved bony ridges passing laterally from the external occipital protuberance. Highest nuchal line are often absent, about 1 cm above the superior nuchal line. Mastoid foramen transmits an emissary vein and the meningeal branch of the occipital artery. To remember the mastoid foramen. Contents of mastoid foramen. Okay, here is the mastoid foramen here. Okay, another one is here, mastoid foramen. Okay, so mastoid foramen for the passage of the emissary vein and the meningeal branch of the occipital artery. Attachment on the Norma occipitalis, trapezius muscle. Trapezius muscle has origin from the external occipital protuberance and the superior nuchal line from the medial third. Ligamentum nuchae is upper part is attached to the external occipital protuberance. Sternocleidomastoid muscle, here insertion on the lateral half of the superior nuchal line, including part on the mastoid process. Splenius capitis is just under the sternocleidomastoid muscle. Okay, splenius capitis it has the insertion there. Okay, occipital belly of occipitofrontalis muscle. This is a muscle innervated by the posterior auricular branch of the facial nerve. Okay, and this is inserting into the galea aponeurotica. That galea aponeurotica or epicranial aponeurosis is maybe attached to the it is attached to the highest nuchal line. Okay, in our specimen I have not shown the very distinct highest nuchal line. It is often absent at that place, attachment of the galea aponeurotica. Okay, we got that. Then we got the galea aponeurotica. Occipitofrontalis muscle innervated by the facial nerve. Posterior auricular branch. Splenius capitis is innervated by the middle cervical spinal nerve like C5, C6, C4 cervical spinal nerve. Sternocleidomastoid muscle innervated by the spinal root of the accessory nerve and C2, C3 nerve. Okay, for the proprioception. Ligamentum nuchae. Ligamentum nuchae is a ligament. Upper end is attached to the external occipital protuberance, other part going over the cervical vertebral spines. Okay, then trapezius muscle, nerve supply, spinal root of the accessory nerve, motor innervation, C3, C4, cervical spinal nerve for proprioception. Okay, we got the attachment. And that's all about the Norma occipitalis or posterior aspect of the skull. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice and wonderful day. Bye now.